Hello, good day. Good evening. It's Chief Roger Marten from Colic First Nations. Today is October 26th, 2021. Um, I'm here to do my story on the COVID and what I went through personally. Um, I was incubated on September 6th. It just took me a little longer to get back into where I am today. So thank you all for the prayers and all the blessings. Would have never done it without Dr. Ghauri here and Lillian, the health center. Getting back to how it all started was, I wasn't against the shot. I just figured that I got sick before and I was kind of immune to it, and that's just ignorance on my part. I figured I'm a healthy guy, don't smoke, don't drink, never been sick really. I've been exercising quite a bit, and I thought one of those things could never happen to me. I'll just brush it off. I did it before, and I figured I'd do it again. But this time, when it hit, it just hit so hard. And like I said, I didn't consult with any medical professions like the doctors and stuff. I just kind of was said, yeah, I did it before. I'll do it again. But that wasn't the case. And it was offered to me on numerous times, like for the shot and stuff like that. But again, I just, put other people first and said, we'll let them get it, and I'll just kind of just go about it. I keep a pretty low profile. My circles are pretty small, so I figured I'll be okay. But at the end result was I did catch it. It did put me out. I don't remember a whole lot prior to it. I just remember kind of getting sick. My air just started to close. I couldn't breathe, and I just tried to do what I did before. I took my penicillins, my animoxils, my antibiotics, and my over-the-counter cold, Tylenol, flu, and stuff. So I figured that was good. I figured I'd kick it, but it was just too far in, like too far in. I was too far into it, and my lungs just started to, my breathing started to get really shallow. So I was like that for a couple days, I think for 4 or 5 days, I believe. And September 6th is when I knew I had enough. I called the ambulance. Ambulance came to my house, picked me up. I remember getting in the ambulance. I was going to get driven in, but I didn't have enough power to get up. But when the ambulance came, I did remember walking out of the house. I did remember going to the hospital. I remember walking in. I remember sitting down. I remember them hooking me up. And next thing I woke up 2 weeks later. I was seemed to be okay, but there was a lot more to it in the 2 weeks that I was incubated, like in an induced coma. There was a lot more to it. From my experience, it was I I got sick, went to sleep, woke up, I'm okay. But there was a lot more to it with the peaks and the valleys of my health. I was doing good, then I dropped to really where it didn't look so good for me, and you know pulled through. When it got to the point where it looked really bad, and they were going to put a trach on me and start to really get serious about you know what the options were, very very slim to none. My for whatever reason, the prayers worked from all of you. My health shot back up to my health shot back up, and I was on a continuous climb to the road of recovery. Um, I've been on a road of recovery ever since. I woke up on a Saturday. By Wednesday, I was strong enough to walk out of the hospital. I came back here. Dr. Nagari was here to help me with Leanne in the health center. They've been checking on me every day. When I got back, I had to learn how to walk, basically talk, eat, and all my everyday functions that most people take for granted. I had to learn that all over again, and you know, it's been definitely an uphill climb to get back there. But I knew I had to get back to the community and to tell my story and hopefully make some changes in people that could happen to anybody. Look, I'm a living example, and I was fortunate to have the medical staff and the right people in my corner to help me get through this. There's a lot of people out there that take say take think like I used to think and say that it can't happen to me. I'm okay with it, but that's not the case. This variant has no discrimination on who it attacks, whether you be old, young, big, small, whatever. It just when it hits you hard and it hits you fast, and unfortunately, that's just the way it goes. And it's it's pretty scary once you wake up and you're in that hospital and you're all by yourself, and you're just thinking about your loved ones and stuff like that. And
Absolutely.
like for myself, I was just wanted to get back home and get back to the community and get back to the people that I love. And I knew that once I get home, I'd heal that much faster because I have that much more support group. And I'd just like to say thank you to everyone who called in, was concerned about my health, and I'm making a full recovery. It's going to take a little while. As you see, I probably lost a little weight. I was in coma. I lost like about 54 pounds. So I lost whatever muscle I had. I went in about 255, came out at 204. So if there's a silver lining, I do all my other underlying health issues kind of went away. So I'm leaner, I guess.
You're
And
very lucky.
I'm a very lucky that guy that way. And I just want to say I'm very thankful for the staff and the medical professions, and all the people in Edmonton, all the people in Cold Lake, and everyone that rallied around and got me to where I got to be. I'm very thankful. And never take anything for granted. Every day is a blessing now. So
Absolutely.
yes.
So Roger, I want to thank you first and foremost for sharing your story with the nation, because I think that's really important. I think there's a lot of people who are kind of on the fence like yourself.
Mm-hmm.
You weren't really necessarily against the vaccine. It's just every time that it was offered, like you said, you thought that you had it in the past.
Yes.
Right? Like you had been very sick in the fall prior to the pandemic, and you thought that you had had it. And so I kind of want to dissect your story a little bit, and I think just to maybe help dispel some other disbeliefs that are out there in the nation in regards or around vaccination, if that's all right with you.
Yeah, absolutely.
Okay.
Like I said, I got sick and I thought I was okay with it because I thought I had built up an immune to it, but it was probably something else.
So when you said you got sick, this was just around the time when COVID was first coming out, and you became sick and you had a really bad pneumonia, and you thought to yourself that, like in hindsight, you thought, hey, I've had COVID, I must be immune to it. And that's why you thought, okay, well, I was strong enough to fight it off before, and I'll be strong enough to fight it off again. Is that what you were thinking at the time?
Yeah, exactly what I was thinking. I figured, like, I didn't consult any medical advice or any medical professions. I just thought, well, I did it once, I could do it again. But obviously that wasn't the case. And like I said, this...
Yeah, and I think that's a really important point, because we have had a lot of people out there who had like the first wild form of the virus.
Yes.
Yeah.
And quite honestly, it was quite different than the Delta variant that you
Oh, yes.
had. And so there have been people in our community who have had COVID more than once.
Oh, I definitely recommend that if you did have it before, or you thought you had it, I would highly recommend that you get a shot. I'm going to get my shot as soon as I'm eligible. Because of the medication that I'm on, I'm not eligible for a shot just yet, but I'm definitely going to get it. And because
we have a date, December 8th.
Yeah, a lot of my friends and stuff that were skeptical on the fence, guys from the gym and guys from just in the community that knew me and elsewhere, they said, Roger, you're a healthy guy, you're pretty good. And as soon as that happened to you, we went and got your shot. Like, we got the shot. If it could happen to you, it could happen to anybody.
Absolutely.
So I'm glad that they did. I'm glad I could save a life, maybe change a life from my experience. But I really would advise everybody to go and get their shot.
In the weeks following your hospitalization, our immunization rates went up huge.
Yeah.
So I believe, the fact that you were so healthy and that it did hit you so hard and this community knew you so well, that really prompted people to take a second look at the vaccine and their choices. And so thank you very much for that. I think that's really important.
I think so. I think so too. And one of the things I want to actually just say right now is, because I very much am for the vaccine, and for as many people on the nation and elsewhere to get the vaccine, whichever one they can get, I want them to get. But I also want to take this opportunity, because I know this is not going to be the easiest thing for you to come out and talk about, but being somebody who's a leader here and somebody who's in a position of power and who is an elected official, you represent a lot of people in Cold Lake and on the First Nations. So I wanted you to kind of, I wanted to get across that anyone in this position can make mistakes. Anyone can have a thought process which may or may not be great when it comes to being allied with health professionals. But I commend you for coming out and doing this, because it takes a lot of bravery to do it. But I also want you to be somebody who actually purveys and pushes the message forward, to be able to say to anyone who's out there who's hesitant, you may meet them in the street, you may meet them anywhere, that they should be getting the vaccine, and as soon as possible, so that we can get out of this nightmare.
Absolutely, I agree with you 100%. I said, for myself, for my family, like I always told them, get your shot, get your shot, get your shot. And, unfortunately, it took me getting sick to open up a lot of eyes. And, if that's what it takes, then so be it. If I could save some lives, then I did. I was just fortunate enough that I pulled through about it with my health. As, I wasn't against the shot. I was always for it. I just kind of procrastinated and said, like I said, it's just bad thinking on my thought, thinking I was immune to it. Obviously, I wasn't. So
It's an easy mistake to make, and I want to make that point too. And I also want to make the point to everybody out there that I don't think anyone cares what you think in regards to your reasoning behind not getting the shot. I don't. At this moment in time, as a medical professional, especially working in this community, I don't care. There is no reason why I can see out there why you would not get the vaccination. There's plenty of stuff that we see on social media, plenty of misinformation out there as well. But we have a person like Roger here who comes up and comes in front of everyone and says, hey, I made a mistake. And now, I'm telling everyone, please, please, please go and get the shot. And I think this is living embodiment of there are second chances, but some people are not as lucky to get them.
Yes, and we have had a few of those people on our nation that unfortunately we have lost in the last few months due to COVID. And so you coming out tonight and sharing your story is really important because there's people on all sides of this issue, but the one thing that we have to have is unity. And as a leader in this community, you're really uniting this community to come together and get past this pandemic.
Yes.
Because really this is our way through. We've had excellent vaccination rates since you went into hospital, since we've had other family members in hospital around this nation. I'm sorry that it's taken that much for people to see past the misinformation that's out there. But you stepping up tonight and being able to share your story goes a long way because people know you.
Yes.
And they know your history, they know your health, and they know, that you take your health seriously. And so being able to show now that yeah, you know what, I should have got my shot when I was offered the shot, darn it. And don't ever do that to us again. Because you scared the hell out of both me and Dr. Ghauri.
Yeah.
Scared a lot of people. I got a lot of calls saying, I don't know if I should hug you or kick you in the butt.
Yeah,
Like that.
and that was my first reaction when I saw you as well.
Yeah, but you know what? You kicked everybody else in the butt because honestly, it did prompt people to come in and get their shots. And I'm not stopping there because we still have a long ways to go, guys. We still have, a good 30% of this population on our nation who need to get their vaccine done. I'm not going to be happy until we have 100%.
100%. We need to be in a position where vaccination numbers are at the very least in the 90s, okay, for us to have any kind of chance. Because my feeling, and the feeling is of people before, and going back to Roger's story, is he mentions that he felt he had the virus in the wild initial stages. The reality is these variants are far more potent. And now I have to say, like from my colleagues and other physicians who are working here and abroad, there are people now under the age of 50 who are in their 40s who are in ICU, and there are people who are not living because of the potency of these variants. Mm-hmm. And unfortunately, these people are unvaccinated or have only had one vaccine. I can't say this enough. This is unavoidable death. This is unavoidable. Why we can avoid it. We can avoid death. We can avoid death. This is avoidable completely. Mm-hmm. And this is all unavoidable. For us now because we have so many people unvaccinated.
Yeah, and I think that's really the message we need to push. In the very beginning, we looked at a vaccine as being a cure because in the past, we've looked at vaccines as being a cure, right? But that was really the wrong way of looking at it. Vaccines are really just a tool to help improve people's chances. That's what it is. That's what vaccinations are.
So talking about this vaccine and other vaccines, I think it's very important for us to get this across because there's this other misinformation that goes around that people say, well, I've had the shot. You're saying now I can still get COVID. Well, you get the flu shot, but you still get the flu.
Yeah.
And the reality is the flu is much less severe if you get the flu shot. So in the same vein, if you think of COVID, if you get the shot, your version of COVID will be far milder than anything that Roger's been through. And we know this. The only people that you see in ICUs who are vaccinated and are having to be on ICU are those that are elderly, infirm, and with significant underlying comorbidities.
Yeah, if you look at the statistics right
Yeah.
now, there's 80% of the hospitalizations are among those who are unvaccinated, and 90% of the ICU admissions are those who are unvaccinated. So just looking at the raw data, like
Yeah.
make your own judgment here, but the raw data is kind of hard to ignore on this one.
Exactly. And
For
so
sure.
that 20% that are vaccinated is because, and we have to keep that because people say, oh, well, there's vaccinated individuals on ICU, but they have people like who may have blood cancer or some kind of lung
Lots of other
pathology. Lots of other,
comorbidities, yeah,
yes,
for
exactly.
sure. So I think that's really important to keep in mind. I would rather, with a vaccine that, I still might get sick, but I'm not going to die. And so this is one of the, I guess, things for the vaccine
Yeah.
that we need to push is yes, you may still get sick with COVID, even with a vaccine, although your chances are very minimal. But we also need to stop the pool of infection. And this is why we're pushing so hard for this 90% right now, or even 100% on our nation. Because as long as we allow the virus to continue circulating through a population, we run the chance of more mutations happening. Now, you were infected with the Delta variant, and that was a nasty bug.
Ooh, bad.
It was bad. Okay, a lot different than the Alpha variant that we saw during the spring and the summer. Even with the Alpha variant, it wasn't near
No.
the amount of mortality, associated with that, or even the first wild COVID type virus that we
Yes.
saw. And so this is why it's so important that we hit that 100% and stop this pandemic in its tracks, because as long as we are allowing people to get COVID and transmit COVID, then it stands a chance of mutating.
Oh yeah, when it hits like, from my experience, it hit fast and it hit hard.
It hit you like a ton
Like,
of bricks.
yeah, it just
Yeah.
knocked me right over.
So the other part of the vaccine that you need to keep in mind is you're protecting others by getting vaccinated. Remember, if you're vaccinated, fully vaccinated, the amount of virus you carry, even if you have COVID, is negligible compared to somebody who is unvaccinated, which means you're less likely to transmit it to grandma or to anyone else who is vulnerable. And so for that reason too, just not for yourself, think of the others that are involved in your family who may have underlying comorbidities, who may still be vaccinated, but you go and see them, but they do get COVID from you. They may not last as long, and they may actually suffer because of it. And I also want to point out, like, we see Roger now the way he is, and Roger's, once he was intubated and he was in an ICU, Roger has no recollection of what happened during that time. And take it from me, the guy who tracked him for the 2 weeks he was on, it's the most stressful thing for me was to watch him wax and wane. And some days I honestly didn't think he would make it. And some days, there was some hope. And, the whole point is to know that, yes, you see him before and after and you see this thing, but that 2 weeks is probably something that you wouldn't want to put your friends and family through, firstly. Secondly, the reality of why we haven't gone to triage protocol in Alberta is because we didn't have to, because people who went to ICU in the majority passed away. And we had more people dying. And at one point in Alberta, we had somebody dying every 6 hours, statistically. So when you think about our small population and having somebody die in Alberta in the province, that's the reason we didn't go to triage protocol, because we didn't have to pick and choose who lived, and because people who made it to ICU, quite a few of them just passed away on ICU because they couldn't take that trauma to their body. Because
I remember hearing
yeah,
those stats
yeah.
one day. There was Dr. Henshaw had reported 35 deaths in a 24-hour period, and that kind of takes your breath away when you sit back and you think, oh my God, that's
Per
more
hour.
that's more than 1 an hour.
Oh, yeah.
And like I think back to the spring the spring of the pandemic when it first began. That if somebody died in ICU, it was horrible if one person died.
Yeah.
Let alone 35 people in a 24-hour period.
And that's why we didn't have to go to triage protocol. And that's why you sitting here right in front of me is still such a miracle, considering the percentages of people who passed away, even getting a ventilator, getting a bed. So, there's a large percentage of people who didn't make that. And, the thoughts and prayers of your community and the people around you and your loved ones brought you through this, as well as your own will to fight, because you're a stubborn old goat as well. but the reality is here, I want like everyone to learn this as a lesson, to say that vaccination would have stopped. If you were vaccinated, I can say categorically now,
Yes.
you would have been nowhere near an
I see.
ICU.
No, I would have lost some weight, but not that much.
No,
Yeah, for sure.
No, but
And
like I said, when I woke up, I was in hospital. I saw all these other people in the ICUs, and I'm like, man, I hope they're okay. And I realized that I was one of them, and it's just
Yeah.
like you kind of feel for these people. I mean, you look at them and think, geez, it doesn't occur to you that you were in that position because you just woke up. But you look at these people, and go, man, they're coming in and all that. You're going, you just watch the doctors and the staff working them, putting them, getting them prepped and all that, and you're like, wow, I hope they're okay. And all you can do is just, geez, I hope. You kind of like, feel for them and don't realize that you were one of them, right?
You were one of them.
Yeah.
And like I said, we got calls every day, you know, from your community members here, your citizens on the nation asking, how's Roger? How's Roger? Because they all knew how sick you were.
Oh, yeah.
And so your body went through some significant trauma from the time that you were admitted till the time that you got back home.
Might have something to do with why I pulled through is because I was healthy. All that muscle just kind of saved.
Absolutely. You know what? Being healthy going into this is probably what did save you. That and the drugs that they gave you to try
Well,
to
yeah,
help
I mean
combat.
that's one of the things. The reason why Roger is not vaccinated right now is because they gave him immunosuppressants, which didn't allow him to get the vaccination as yet. And he, that's why you've got that certain date for that.
That's why I've got a date with Roger on December 8th, because that's
December
the
8th.
earliest that we can immunize
Yes.
you, but I've got it marked on my calendar, my friend.
Yes.
You're not running away
I'll
from me
be
this time.
there.
So I will say that's another part of your story was that we had that you qualified for certain medications. Certain people do not qualify for that medication, and the qualification for that is based on certain parameters. And Roger thankfully qualified for the medication, the administration of this medication, and
Those were the monoclonal antibodies.
yeah, I think they may have given him some immunosuppressants as well, which are I think they're disease modifying drugs such as teclistamab and things like that we use. Okay, but the reality is he got those medications which allowed him a chance of survival, and some of our patients will not be eligible for them for whatever reason. And that would also count against that, and that would have helped him survive this kind of process. And
Well, either way, I'm darn happy you're
Yeah.
still here, my
Me
friend.
too.
And like I said, honestly, you really did help to improve our immunization stats. Your family members coming and your friends coming. And I know there's a lot more who are out there right now who are probably still sitting on the fence, deciding whether or not they want to come and get the vaccine. If there's any story that's really going to convince you, it's Roger's story. Because Roger was healthy as a horse coming into this. And this disease really did play havoc on his system
it changed his life forever.
It changed his life, yeah.
Exactly. Like I said, I got a second chance. Lucky for that. Lucky for the staff, the medication, and the people that were praying for me. But going forward, I would like to see a lot of people get their shots, get immunized, because they may not be as lucky or in my situation to get a second chance, whereas I did. And I wouldn't want anybody to go through what I went through. It's not something that I want to see anybody go through. It's
And we have the ability to stop that. So guys, those of you who are out there, if you haven't gotten your shot, come in and get your shot.
If you have any questions, please look honestly, rather than just keep them inside, bottled up. Go and speak to a medical professional. Speak to them. Try and allay some of your fears. Try and get rid of some of the misinformation, because there is so much out there. And listen, any medical professional worth his salt is more than happy to discuss the benefits of the vaccine. Okay, be it Lillian, be it myself, be it any of the physicians here who would kind of sit down with you and just kind of answer some of your questions. And I, for one, am more than happy to do so. I know Lillian is more than happy to do so. And we can talk to you specifically about specific fears in consultation. I know that we have a nurse practitioner here who is also available to talk about the vaccine as well. So, as I said, if you have any concerns, it's confidential. Come in and talk to us, and we can kind of discuss any of the potential concerns you would have.
Just reach out. That's all we ask.
That's it.
All right.
Okay.
Well, thank you very much, Roger, for
Thank
sharing
you.
your story with you. Thank you, Dr. Ghauri, for
My pleasure.
coming on and helping to I guess, frame his story, because
Yeah.
he doesn't quite remember all the stuff
No,
that happened
well,
at the beginning of his story.
Like
or-
I said, I went to sleep, woke up.
You
That's
went to
pretty well
sleep
it,
and woke
yeah.
up,
Yeah.
yeah.
But no, like I said, on a closing note, I just like to see everybody that listens to it. Hopefully, they could learn from my experience. And you know, it's like I said, it's you're not immune to it. It could happen to anybody. It happened to me. As a healthy guy, I like to see everybody get their shots, or you know, get at least consult your medical professions to see what your options are. But don't be afraid of it. Like. You know, if you said you got sick, I'm immune to it. Well, obviously that's the way I thought, but it doesn't work that way. This new variant, it's deadly. Like it's crazy. Like it's so strong, so powerful. And like I said, when it hits you so fast. You got no time to think. You may think you're okay, but realistically, you're just dwindling down and down and down. And that's what happened to me. You know, fortunately, I had a good medical staff here, and they got me to where I got to go. So I'm on the mend now. So. I'll be back.
You're back in the saddle, my
Back.
friend. All right, so everybody out there, again, please come in and get your vaccination done. Remember, we've got about 2 months till Christmas. There is a chance we could have a normal Christmas out of this if everybody comes and gets their vaccinations done. So please, I want to see this community back together, celebrating together.
Yes,
Please come in.
absolutely.
Yeah.
All right.
Okay.
So thank you,
very
Master Cho, and have yourself a good evening. Thank you.
Thank you.
Bye-bye.